As the demand on the NHS grows year on year, with tighter budgets and more expected of their services, to add to hospital struggles, the NHS is also facing a recruitment crisis.
Yeah, this is a problem everywhere, but Salford Royal NHS Trust say that they have 200 vacancies for doctors and nurses that they're really struggling to fill. But they hope they've found a solution.
They have partnered up with a building firm so that along with a clinical job in their trust comes the offer of a rentable home too. Rachel Townsend reports.
Go look at your temperature as well, OK?
Charlie Chapazzoni arrived as a nurse at Salford Royal 6 months ago. Recruited from Madrid, he knew little about the Northwest and had just a week to find a home.
When we first arrived here, we didn't really know the areas, what areas to kind of avoid, what to actually look for. And it took us a long time just walking about and actually getting a small insight before we actually chose a place to stay in.
The bosses at Salford Royal NHS Trust want to give new medics a more settled start. Together with Salix Homes, they're building properties exclusively for doctors, nurses and other clinicians to help coax them into hospital jobs. Salford Royal currently has around 200 vacancies. The Director of Nursing believes creating affordable housing will help entice people to take up those jobs.
All health professionals are welcome to come and join us, and we're doing as much as we possibly can to recruit and retain staff.
Is this accommodation a big enough draw to attract people and solve your recruitment problem?
Absolutely. There is a national shortage of clinical staff across the NHS, so as much as we can possibly do to recruit and retain staff into Salford Royal is a positive thing for us.
The 26 one- and two-bedroomed apartments will be available to rent for 6 months after an employee takes up a position. They'll cost between £500 and £600 a month, which will be deducted from their NHS wage. Well, 3.5 years ago, this housing complex was devastated by the Boxing Day floods. Since then, over £2 million has been spent on rebuilding, partially funded by Homes England. The NHS will pay for each property to be fully furnished. Where's that money come from?
So that's a small amount of money that we've got from inside of Salford Royal. We know that the more people that we can attract, the less we'll need to rely on premium rate staff, and so we'll save money probably in the long run.
For us to bring people into Salford and to see how fantastic Salford is and to work in such an iconic hospital, fantastic.
While the British Medical Association recognises the benefits of such a scheme, they're realistic about the impact it'll have.
Let's not think that this initiative will solve recruitment and retention of doctors in the NHS. There are bigger issues such as excessive workload, a lack of flexible working hours and work-life balance. It won't be the solution, but it will play some part in providing more attractive terms.
The homes will open in the autumn. Salford Royal are now on the hunt for nurses like Charlie to fill them.